see you. Do you have an appointment today? Oh. Last name, please. Perfect. All right. Yep, I see it in the system. Well, welcome. My name is Leanna, and I'm going to be the medical assistant doing your vitals. What's bringing you in today? First Pap Smear. I take it you just turned 21. Gotcha. All right. Are you having any other concerns with your Pap Smear that you'll be getting done today, or? The Pap Smear is stressful enough. Yeah, totally understand. Have you ever seen a gynecologist prior? No? Okay. All right. Are you on any medications right now for anything? Okay. So I take it no medical history is significant. Okay. Have you had any surgeries? Nope. Awesome. And do you smoke or drink? And by smoke, I'm referring to cigarette use or marijuana use. Okay. And how long now? All right. And what are your preferred pronouns? All right. Good to know. Thank you. And any family history of breast, ovarian, or uterine cancer? Okay. Mom or dad's side? And do you know roughly how old they were? Okay. Do you have any allergies at all to any medication? Okay. Do you get periods regularly, every month? About every 28? How many days do they normally last? Are they painful at all? First couple. Super heavy, light flow, moderate? Okay. Good to know. Absolutely. And can we get an emergency contact for you? Okay. Now, kind of a personal question. Unfortunately, at the gynecologist, we can get a little bit personal, but our goal is just to make it so that it's part of everyday conversation. We normalize it, we normalize sexual health, and just making you feel protected and comfortable. So, have you ever been sexually active before? Oh, you're a virgin? Okay, all right. Now, I just have a follow-up question to that. How do you define virginity? So, essentially, what makes you say that you are a virgin? How do you identify as a virgin in your definition? So, never had penetrative sex with a male. Okay. Now, let me ask you this. Have you used tampons before? Okay. And everything go okay there? Good to know. So you've never had other forms of sex, whether it's oral sex, anal sex? Nope. Okay. Thank you so much for the clarification. I feel like virginity is sort of this complex term, and depending on religious background, ethical beliefs, for each person, virginity is defined as something very different. So for some people, they don't insert anything ever in the vagina, even tampons, because any form of, you know, a torn hymen makes someone not a virgin. Other people, it's having penetrative sex with a male partner that makes someone a virgin or not a virgin. So thank you so much for the clarification, because, you know, from our mindset, you know, we're just looking for what will be best for you and what you're looking for. But, you know, for us, things like virginity checks, I'm kind of going on a little bit of a rant here, but that's a whole other conversation. Okay, so good to know. Now, regarding the Pap Smear, are you familiar with it at all and what it entails? Sounds like you kind of did a little bit of research. Well, when the PA comes in, she'll kind of go over it with you and kind of figure out what your comfort level is as far as getting your first PAP, being that you've never had sex. Yes, but we absolutely can still do it despite that. It's not necessarily like a requirement. Yes, and honestly, just thank you so much for taking care of your cervical health. For sure, for sure. Okay, so can I get some vitals on you? Cool. Thank you so much. Let's just get some sanitizer. Yes, our goal is honestly just to make you feel at home to the best of that we can, but honestly just super comfortable with who you are, you know, your background and all of that. Yes, exactly. I apologize for all of the car sounds and airplane sounds. Yep, we are near an airport. You're not having any fever or chills today, correct? And no COVID exposures recently? No one around you sick? Good. Oop, I'm struggling today, I can already tell. I've been here for a couple years now, yep. Yeah, I love my job. Okay, if you don't mind lifting your tongue, this is just going to sit under there for a minute. Perfect, temperature is good. Let's get this taken care of and packed up. Now we're just going to take your blood pressure. Do you know how tall you are by any chance? Okay, cool. So this is an electronic cuff here. I'm just going to wrap it around your arm and the machine will take it. Yes. Let me know if you're too uncomfortable. Okay. We'll use this arm. Perfect. Does that feel snug? Blood pressure is normal. We're on the right track. Okay. All right. So, would you prefer to get undressed now, or would you rather meet the provider first? You're okay getting undressed now. Okay. So, here's what we're gonna do. I am going to leave you with this white drape. You are going to get undressed waist down. You can keep your socks on. You'll cover yourself up with this drape. You'll lie it over your waist just for some privacy. Just don't wrap yourself with it because sometimes it can make the exam a little bit more difficult because we get kind of tangled in the blanket. And then Leanna, the PA, will be in to kind of walk you through your first PAP, okay? Absolutely. It was so nice to meet you, and wishing you the best of luck. Hello, I am coming in. Hi, my name is Leanna. Nice to meet you. Perfect. So the medical assistant was just giving me some background. You are here for your first Pap test, but you identify as a virgin, correct? Okay. Well, thank you so much for coming in for your first Pap test at the appropriate time. You know, Pap smears are very important to screen for cervical cell changes, God forbid cervical cancer. Now, of course, given that you haven't been sexually active, this definitely reduces your risk, you know, significantly. So, you know, not expecting your Pap to be abnormal per se, but guidelines still recommend that even if you've never been sexually active before, that you still get them. So again, thank you so much. Yeah, so let's talk about it. So, my glove broke. 1 second. Let me just grab another one. Sorry about that. it sounds like you've done a little bit of research. So the way we obtain a Pap smear can be done in a few ways. The most common way you'll see, and the best way really, is we take a device called a speculum, we insert it into the vagina and open it up, because that is how we see your, vaginal walls, make sure everything looks healthy, no sign of infection. This is how we see and identify your cervix, so that we take these brushes here and we, use them to obtain a proper Pap smear sample. So that is the way we usually go about it. Now, with that being said, there are some people, especially people who have never had sex before, that feel as though the speculum is way too much, causing too much pain, and that is when you will please verbalize with me that you are too uncomfortable and that you do not want to continue, and I will absolutely take that out right away. So really, it's a lot about communication and doing what you're comfortable with. I always tell people to never feel bad. Worst case scenario, what I can do is take the brush and do what I call a blind pap, where I stick the brush in without the speculum, kind of twirl it around in there, and a lot of times those paps will come back conclusive for getting cervical cells, despite me not being able to see the cervix. Does that make sense? Yes. So what are you comfortable with? Are you comfortable if we start with like a pediatric speculum and see how you do, and then we could try to get the pap through there? Absolutely, yes, for sure. So what I'm gonna have you do is, if you could scoot a little bit more down for me. Let me take the stirrups out. Yep, you'll put one foot on each side. Perfect, awesome. So here's what we'll do. I'm gonna kind of get you situated here. This first part is just an exam where I look on the outside. So you'll feel my gloves on the outside here, and I'm just going to look with the light. Yes, okay. All right, outside exam. All right, everything looks very healthy on the outside. No suspicious moles or lesions. I'm going to grab a pediatric speculum. So this right here is our pediatric speculum, to give you a size comparison of my finger. Very thin, very short, very narrow. Let me pull out another speculum, like our standard size, just so you can see the difference. And this would be our standard size. Pretty big difference, huh? Yep. We will try the best we can to visualize the cervix with this speculum. Absolutely. Now the way it works is we take the speculum here, we insert it into the vaginal opening, we open it up, take a look and lock it in place to see the cervix, and we get our samples. Make sense? Good. All right, but like I said, this is about your comfort, so please, please tell me if you are too uncomfortable. Good. Okay. You are going to feel my hands here on the outside. Okay. We're gonna insert. You doing okay? Good. You let me know if you're not comfortable. You're not comfortable. I'm gonna take it out then. Yep, it's coming out. Okay, and that's totally okay. Would you like me to try to obtain a Pap smear with just the brushes going in? We can absolutely do that. Okay, so we're going to use this brush right here. It's called a cyto brush, and I'm just going to insert the brush all the way back there, kind of do a swirl so that we can get some cervical cells. Absolutely. Okay, you'll feel my fingers. Perfect. I got a good sample here. Now the lab is going to tell me if they were able to get any cervical cells. Of course, this is not the most ideal way to get a Pap, but it still is better than absolutely nothing. So please don't beat yourself up about it. You did fantastic. Yes, absolutely. And if this comes back conclusive, then you got your routine screening in. Mm-hmm. All right. Let's close this up. I am going to send this out to the lab for you. Now, are you signed up with the portal? Good, good. So, I communicate through there. If this Pap is not conclusive for whatever reason, I will call you. But if it is conclusive, I will send you a message, hopefully saying that your Pap is normal and you won't need a repeat for 3 years. Yes, between the ages of 21 and 29, as long as there's no history of an abnormal Pap, you only need to get a Pap every 3 years. Now, I say this as a heads up because you may have some friends that tell you that they get Paps done every year, but really it's either because maybe they've had an abnormal or they're getting it yearly just because insurance covers it. Exactly, exactly. But you know what? You did absolutely fantastic for your first Pap. And of course, you see me sooner than a year if you need to, if any concerns, if any questions. If you haven't had the Gardasil vaccine, I highly recommend you get that to protect yourself for when you do become sexually active, depending on what sexual partners you have. It was absolutely my pleasure. Again, so nice to meet you. So if you want, I'll just see you yearly just for routine checkup, but you won't need a Pap for 3 as long as this one is normal. Absolutely my pleasure. You have a great day.